7 signs your testosterone level is diminishing fast. It is now known that low testosterone is likely to increase the possibility of premature death and lowered quality of life for men. Low testosterone is frequently accompanied by a lower than expected sex drive, erectile dysfunction, low bone density, and there is also the possibility of sleep disturbance, depressed mood, diminished physical performance, and a constant feeling of being tired. All of these things tend to make one feel like less of a man. Low testosterone is a serious problem then and should be treated promptly. The depth of symptoms of low testosterone does depend on how low the level is. In other words, low testosterone may lead to a lack of energy on a day-to-day basis. How that energy level sinks directly corresponds to how low your testosterone level is. If your libido is low but there is some sexual interest remaining in your psyche, then it may get worse if your testosterone level gets lower. Additional symptoms of low testosterone include erectile dysfunction at the lower end of the scale, loss of facial hair and body hair, and increased body fat. Inevitably it seems to correspond with our stereotypical image of an old man. Low T, another expression meaning low testosterone, does decrease in all people as we age. While we generally think of women as suffering from osteoporosis, that is lessening of bone density, the reality is that a percentage of men also suffer from osteoporosis, and usually this is in direct proportion to the decrease in their testosterone levels. You find it hard to knock off extra fat and weight. You lose lean muscle mass and strength and gain weight, especially around the waist. Your cholesterol levels increases, particularly LDL, which can be a reason for cardiac problems. You face sleep problems, excessive sweating, depression and loss of hair. However, the most significant of all is the decline in sex drive or libido. It is when you face sexual or erectile dysfunction that you realize that something is amiss and needs to be treated. Usually men try to solve this problem through prescribed medication rather than getting to the root of the problem. This condition is often referred as andropause. Millions of men might be going through his right now around the world without even knowing it. Andropause is detectable through blood tests, but in most cases not just an ordinary blood test will do. An ordinary blood test can tell your doctor how much testosterone is in your system, but that doesn't tell him how much of it is available for your body's use. Sex hormone binding globulin attaches itself to testosterone and other sex hormones, rendering them useless. Also, different men need different amounts of testosterone to function at their best.